Assalamualaikum warahmatullahi wabarakatuh and hello everyone. Now we will start our presentation. My name is Aqilah Binti Fawzi and my partner is.
Hello guys, my name is Nurhanis Safia Binti Junaidi. Nice to meet you guys.
Now we will begin our presentation. What if one day you were sitting and reading news about COVID-19 and suddenly your chest becomes tighter and you find it hard to breathe? This is proven to be panic attack. So what would you do? Would you do nothing or would you take action to prevent this from occurring again? The study published by the Lancet Psychiatry analyzed that within 3 months of testing positive, almost 20% of people diagnosed with COVID-19 were then diagnosed with psychiatric disorders, including anxiety, depression, and insomnia. Next slide. What is mental health and why is it important? The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contribution to his or her community. Next slide. Me and my partner plan to talk about the methods to cope with mental health issues during COVID-19 pandemic. I have done a lot of research about mental disorders such as schizophrenia since I am very exposed by it. This presentation will be divided into 4 parts, which is the introduction, 2 methods to cope with mental health issues during pandemic COVID-19, and the conclusion. The first method to cope with mental health issues during pandemic COVID-19 is by taking good care of your mind and body. Next slide. Firstly is by having a good rest. Good rest means quality sleep. Sleep disturbance worsen the symptoms of mental conditions. Not enough sleep causes difficulty in concentrating. Next slide. The guidelines for quality sleep by National Heart, Lung and Blood Institute state that preschool age children should sleep 11 to 12 hours, while school age children should sleep 9 to 10 hours and adults 7 to 8 hours. Next slide. Secondly is take time to relax. Emotional symptoms from stress is irritability, overwhelm, anxiety, low self-esteem, and depression. When we relax, the flow of blood increases, causing calmer and clearer mind, which aids positive thinking, concentration, memory, and decision-making. Next slide. There are several ways to relax, such as listen to music, talk to a friend, and read a book. Now I will pass to my partner.
Thank you, Alia. Now, let us move to the next main point, which is practice a healthy lifestyle. In this part of presentation, I would like to explain on how to practice a healthy lifestyle that can help us in coping with mental health issues during pandemic COVID-19. Firstly, we need to eat healthy and well-balanced meals. Eating healthy food promotes the growth of good bacteria, which in turn positively affects neurotransmitter production. When neurotransmitter production is in good shape, your brain receives this positive message loud and clear, and your emotions reflect it. But when production goes awry, so might your mood. Dr. Gabriela Cora, a board-certified psychiatrist, said when you stick to a diet of healthy food, you're setting yourself up for fewer mood fluctuations, an overall happier outlook, and an improved ability to focus. Hence, to boost your mental health, You need to focus on eating plenty of fruits and vegetables, along with foods rich in omega-3 fatty acids, such as salmon. Another foods such as dark green leafy vegetables, in particular, are brain protective. Nuts, seeds, and legumes, such as beans and lentils, are also excellent brain foods. Next, we need to exercise regularly. Journal of Occupational Therapy shows that exercise can contribute to improvements in mental health symptoms, including mood, alertness, concentration, sleep patterns, and also psychotic symptoms. In terms of the biological mechanisms, exercise has been shown to cause changes in certain chemicals called endorphin. Endorphins are the feel-good chemical messengers that help relieve pain and stress during exercise. Hence, exercise can improve mood and reduce symptoms of mental illness, such as depression and anxiety, improve sleep quality, increase energy levels, and also reduce stress. According to James Blumenthal, a clinical psychologist at Duke University, there's a good epidemiological data that suggests that active people are less depressed than inactive people. In conclusion, researchers have noted marked increases in levels of stress, depression, anxiety, and loneliness in the overall population over the course of the pandemic. In the words of United Nations Secretary General Antonio Guterres, we are in this together, and we will get through this together. You and I, we are not alone. Hence, do not be afraid to reach out to people and take appropriate ways to cope with mental health issues during this pandemic COVID-19. Well, that's it from me and my partner. Thank you very much.